I would like to call to order the April 2nd, 2024 Cabarrus County Board of Commissioners work session. Welcome, everyone. First up is the approval of the work session agenda. You all have a copy of that before you. Do I hear a motion to approve the agenda, including the changes on page 3? Okay, we have a motion and a second. Any discussion? All in favor, please say aye. All opposed, no. That motion passes. I will mention that I got a message from Commissioner Meismer earlier today saying that he would not be able to attend tonight. He did not give any reason. And so we move now to discussion items. First up, item 3.1, 2023 Child Protection and Fatality Team Report. Happy to have Paula Yost and a number of associates with her for that report. Welcome.
Hello, my name's Hannah Arrowwood. I am not Paula Yost. She will be coming up after me. But I want to just bring something to your attention. We all greet each other by saying, hi, how are you? But the famous Maasai tribe in Africa, specifically in Kenya, greet one another by saying, how are the children? And that's what we want to talk about today. The children, my friends, are not well. And it's time for us to take responsibility and accountability for changing that narrative. This generation is plagued with normalities that none of us in the room ever had to face. Social media is all-consuming, mental health needs have never been greater, and sexuality is being encouraged and groomed younger and younger. But why does this matter? As the Executive Director of Present Age Ministries, we are committed to combating the sexual abuse, exploitation, and trafficking of young girls. And for 15 years, we've watched this only increase, including here at Cabarrus in Cabarrus County. We throw around words like freedom, but what does it actually mean to be free? And is freedom just a physical thing, or is it also emotional and spiritual? But what I can tell you is this is what we have to advocate for. And I want to give you a glimpse into what 2023 looks like for one organization that works with the most vulnerable of our children. And to remind you that our children are not well. In 2023, we launched curriculum in Cabarrus County schools that helped K-5 students gain understanding and vocabulary about what inappropriate touch is in efforts for abuse prevention. Because what we know is so often our children don't have the words to tell us what we're hoping that they would tell us. This led to positive disclosures of abuse and will continue to do so for years to come. So again, I ask you, how are the children? Children account for 1/3 of all human trafficking victims worldwide, and 2 out of every 3 of those victims are young girls. And in 2023, Present Age Ministries here in Cabarrus County served 57 girls. Let me break down those numbers. 49 of those girls were involved in our Discovering Your Value program. This is an 8-week curriculum that is a series we created to address the devaluation of our girls. Every girl enrolled in this program is at high risk for being trafficked or has already experienced some form of sexual exploitation. 7 of those 57 girls have went through our For the One and provisional services. This is because they were confirmed victims of trafficking. What does that mean? It means that during that year, 2023, we had 57 children and families trying to understand how to find freedom for their child. Whether or not it was abuse, exploitation, or trafficking should be irrelevant. The fact, if we go back to how we started, is how are the children? In 2023 alone, we received referrals from Atrium Healthcare, Cabarrus County Schools, Department of Juvenile Justice, Department of Youth and Family Services, and the Cabarrus County Sheriff's Office. So before I call up Paula Yost, the chair of the Cabarrus County Child Protective and Fatality Team, and our district attorney, Ashley Shanley, I just want to ask you, what are we doing to protect the most valuable asset of our future, which is our children? Because when our children have experienced these kinds of horrendous atrocities, it plagues them for days, years, and generations. And so as we call forth Paula Yost and Ashley Shanley, I want to just also tell you what an asset it is to have these two women who advocate for the freedom of our children. I work with counties across the metro region, 14, 15 counties wide, and let me tell you, they are an asset, and we should celebrate and celebrate the fact that we have these women who will fight for the freedom of our children. Friends, ladies.
Thank you, Hannah. You know, I asked Hannah to come up and talk first because I wanted us to focus on what's truly important and why we're all here and what we have to talk about tonight. I also just want to briefly comment that about 11 years ago, I was sitting over at Two Gals across the street with Ashley Shanley, and Ashley Shanley said to me, I am going to start a human trafficking task force in this community. I don't think there's one anywhere else in the state. This stuff is here, it's real, and it's scaring me. And I can't save everyone in the whole country. I can't. But I can save the children who live in this triangle. And I'm going to figure out how to do it. And she did. And now she's a national speaker, and everyone who knows anything about this topic in most parts of the country know Ashley and know her work. And we should all be very proud of her because she's someone who takes the concept of how are the children very seriously. Lauren, I have no idea how to control this thing. Thank you. Sorry to give an impassioned speech and then have a technological glitch. Most years I have glossed over this slide. But this year, I'm going to go into a lot more detail about it because I've never really talked to you about who the members of our team specifically are and what the members of our team specifically do. But my understanding is that that is going to be blessed by the commissioners later in the year. And so I want to explain in more detail what we do under statute. First of all, the statute that I'm getting ready to go over with you is likely going to be changed in January of 2025 anyway, and I'm pleased to report that pretty much everything our team already does and figured out how to do years ago is going to be brought forth in the new statute. So we're already doing the bare minimum. What we're actually doing is far more than what the statute asks. So some counties have a protection team and a fatality team. We have a combination team. So we have a team that is protection and fatality, and the reason that we've done that is because it was all the same people. And it made the most sense for us to be able to combine ourselves. What we really are is a think tank. And so when somebody like Hannah comes in and says, well, let's talk about the human trafficking problem that we're having right now with this particular case, we have a group of professionals who sign confidentiality agreements who are able to plan out what is a course of action that we can take. We meet for 2 hours a month, 11 months a year, and this is a conversation that we have. And it's very important that all the people I'm about to go over with you are present at that table, because if it's not, we have something significant missing that we absolutely need in order to carry out our work. I am. Thank you, Ashley. This is where I'm getting old and can't read on a screen anymore and refuse to wear glasses like a mature person, so I'm going to look here. The first person is that the Director of Human Services is statutorily required to attend our meeting and also a member of her staff. I will add, however, that the statute is too narrow with regard to this requirement because at Cabarrus County DSS, we have investigations, we have foster care, we have in-home services. We really need somebody from each of those teams to be at our meeting because we could have a child in any of those positions, or we could have a child who at this time doesn't have DSS involvement at all. There are children who have loving parents who are not neglecting them, who are just in a bad situation, who have fallen into human trafficking, and there's no DSS involvement. But we can't just have a DSS member from foster care because we might need to know what's going on in in-home services or in some other capacity. And so we need those people to be appointed. Justice Johnson has been a rock star on this team. She's been here longer than I have been here. Everyone speaks to her and goes to her with what we need. And so I would absolutely like to see Justice continue. But we also need many of the other folks who are there. Katrina, Kelly Heinball, they're all very important. Next up is the statutory requirement for one law enforcement agency. So our county is very unique, as you know, because we don't have one law enforcement agency, we have 3. And those law enforcement agencies do not speak for one another. So we need someone from the Sheriff's Office, which is Andrew Kelly, from Kannapolis, which is Glenn Thiegen, and from Concord PD, which is Ben Little. Because if we don't have those folks, again, something could be going on in one part of the county and that we don't know what's going on in another part. Ashley, I'm going to let you talk about your office for just a moment.
The district attorney's office has been a part of this team for at least 15, 20 years. And we don't just send one person, I send me. I think it's important that the district attorney is at this meeting, so I'm there every month. But not only do I send myself, I also send our investigator, April Samples, who's sitting here behind me. And we also send Keisha Scott, who handles the majority of our sexual assault and physical abuse cases. And then when available, we send our victim witness team. I only have 20 people in my office and 4 are coming to this meeting every month. That's how important this is. And so we want to continue doing that. So we don't just send 1, we're sending 4.
Thank you. There is some statutory requirement for a local community action agent. That part of the statute is a little bit more convoluted. Ann Benfield and the Cabarrus Partnership for Children satisfy that requirement. If Ann's ever unable or unavailable to attend, she sends Starla Hatley. Starla is also incredibly important because not only does she work at the Cabarrus Partnership for Children, she's also a nurse. And so we frequently have to conduct intensive state fatality reviews, which I'm going to give you more information on the difference in that and what we do in a few minutes. But Starla has probably attended more of those meetings as our medical expert than I can count. She's probably done more of them than I've done, and she's done them recently and close together. So Starla is an A-lister. Anytime I need her, she's available and she helps me. The superintendent of each school administration in the county, again, we have 2 school districts represented in our county. So we have Amy Jewell, who's present with us, and she'll be presenting a little bit more this evening when we get to the parts of the slide that impact her. We also, sorry, I got lost again, I can't read. Thank you. We also have Mackenzie Wofford, who's also here tonight, and she'll be coming up to speak to you in just a few minutes. And then Keisha Sandage also serves from the Cabarrus County Board of Education. The Board of Education is not a required seat at the table, but certainly having someone from the Board of Education who is knowledgeable of our activities is an important liaison relationship with the school system. We have to have a member of the County Board of Social Services. That's the only seat that we do not have filled at this time, and we welcome whoever is assigned to that. We need to have a local mental health professional. That is a dual position. A lot of our partners can fulfill more than one role. Sonia Bohannon Thacker does that, but I also do that. I am an attorney, but I am also a licensed clinical mental health therapist, and so that is also my position on the board. Our local guardian ad litem coordinator, for a very long time, it has been Rachel Grossman-Zach. Rachel actually left her position. She is being replaced. I do not know that she has been replaced yet, but once she is, that person will be welcome on our team. The director of the Department of Local Public Health, Erin Shue, sends Amanda Privet, who's also here. Amanda has a critical behind-the-scenes role. We could not run this committee without Amanda. Every single time we review a fatality, Amanda takes detailed notes on everything that we did in the meeting, and then she forwards all of those notes to the state for reporting. If the state loses it, if the state doesn't have a record of it, if the state wants to know, have you tabled a case, what's going on with the case, Amanda does all that running around and all of that behind the scenes bookkeeping. She spends hours of her week on this type of stuff. Absolutely critical position. Our local health care provider. We've been very, very fortunate. A lot of counties struggle to get a physician who's willing to serve in this capacity. We have been incredibly fortunate to have 3. So the first one is Dr. Easterday, who is CHA's medical director. The second one is Dr. Robert Silver, who is the NICU director at Atrium Cabarrus, because we do have a number of infants that pass, and we'll go through that in just a moment. And then we also have Dr. Nicole Barrett. Dr. Barrett is from the Children's Advocacy Center, and so we need her because she's the one that goes and does a detailed review of all of our abuse, neglect, fatalities, and those cases. In addition, we have a few additional members that are mandated by statute. One is an emergency medical service provider or firefighter, which, again, language appointed by the Board of County Commissioners. Jimmy Lentz, who's here behind me, has designated Kara Clark of EMS to attend our meetings. EMS plays a very critical role in this because so often somebody dials 911, my child's not breathing. Well, who's the first person who walked in the door? EMS. So we always are asking them, did you smell drugs? Was there anything out of the ordinary? How was everyone acting when they come there? Again, we couldn't do this without those folks. A district court judge appointed by the chief district court judge in that district. Christy Wilhelm had appointed Judge Nate Knust, and then most recently, we have the Honorable Judge Beth Street, who's right behind me. Judge Street actually served in a position with the District Attorney's Office before becoming a judge, but Judge Wilhelm has blessed either or both of those folks to attend our meetings. A county medical examiner appointed by the Chief Medical Examiner, Kevin Gullett of Atrium Health, serves that role. A representative of a local child care facility or Head Start program. So this is also where Ann and Starla play a role. And remember how I mentioned Rachel Grossman-Zach, who used to run the Guardian Ad Litem program? Rachel left that position to take a job managing the Lockhart Child Care Center. And so we would like Rachel to continue because she was such an asset before and because she brings a tremendous amount of history with child welfare to our team. And then last, we have to have the parent of a child who died before reaching that child's 18th birthday, who must be appointed by the Board of Commissioners. That role has been fulfilled longer than I've been here by Sonia Bohannon Thacker, who also runs a nonprofit organization in her child's name and who works at Cabarrus Health Alliance.
One of the things I want to say, I just returned from the district attorney conference where the other 42 district attorneys were there. And I can tell you again and again how many people from other counties say how envious they are of the collaboration that Cabarrus County has. Not only do all the members that Paula just called out come every month, they come with ideas, they come with excitement. And I just want to say we are blessed to have it, and we're asking the commission to make sure it stays and to not do anything that interferes with it, because I feel like we are doing excellent work. And I'm so grateful to work with these partners every day. And for Paula Yost, I say it once, I'll say it again. Paula Yost receives no salary for this position. Paula Yost has a very thriving law practice. She's also a mental health counselor, as you heard. She could do many things, but instead, she decides to come to these meetings every month and make sure that children are the number one factor here in Cabarrus County. And we are grateful for her and her leadership, and we're thankful for her. So again, we ask for your support and certainly not your interference.
Thank you. With DSS numbers, now I want to talk about really important things, which is our children. Investigations worked with almost 5,000 children, which was an increase. It's always an increase at this point in our county, and you're going to see that as we continue to go through this. For our county, of those 5,000 calls, 1,694 were accepted in investigations. Of those investigative cases, I always get muddled in these numbers. 147 of them had substance abuse allegations, and 15 of them had alleged opioid abuse. And then 463 assists were provided for other counties. 14 substance abuse impacted infants, which scares me a lot. I'm going to talk about that in just a second. 148 cases of domestic violence, and in Hannah's numbers, 13 trafficking cases. Someone asked me at one point, if they're getting 5,000 cases, why are they only accepting 1,694? That's because a lot of those phone calls are things where people are saying, hey, I saw this situation, but they really don't know anything about a child. They don't know. They saw something weird in Walmart, but they can't tell you any information beyond that. We also see a lot of cases where it sounds like it's a custody dispute, where you don't need to be using the Department of Human Services because you can't get along with your ex-husband or ex-wife. You need to be getting a private attorney to deal with that. Child abuse DHS numbers. We also had 45 families per month in in-home services, and 182 children in foster care as opposed to last year's 158. Something very important that I just want to say about our foster care numbers. There is actually a grid in the state of North Carolina that you can pull, and it will say if your population is X, you should expect to have Y number of children in foster care, because unfortunately, child abuse and neglect has always existed, and it is always going to exist. If I could eradicate it entirely, I would wave a magic wand, and I would. But I can't, which is why I do this all the time. But it's important to note, while that number is high, so is our population. And I'm preaching to the choir here when I tell you, gentlemen, we are the 10th fastest growing county in North Carolina and one of the fastest growing communities in the country. So it makes perfect sense that we have that many children in foster care. There is a growing movement, I believe, within the state and a lot of thought processes at this point that children just need to be reunified with their parents. And I support and celebrate families who are able to earn their children back. And there are families who have horrible circumstances, but who work their plan and do what they need to do and get their children back. But the unfortunate reality is that we will always have parents who rape, pimp, do drugs with their children, and beat each other in front of their children. That is the fundamental reality of the world in which we live in. There will never be a time where you are going to hear me say all children need to be with their parents, ever. That is not a statement I will ever make in my entire life, and I will not support that statement ever. All children do not need to be with their parents because all children do not have good parents. I wish all children had good parents. If I could make all children have the type of childhood I had with Eddie Yost, I would give it to them. But I can't do that for everybody, and that's an important eye-opening realization that all of us need to have. Commissioner Shue, did you have a question?
I do, but when you get Paula started,
I'm so sorry.
She is so passionate about what she does, I just love it. But the question I had is about for Cabarrus County, where we accepted all of these cases, but yet we only investigated about a fourth of them. And then the others were referred for family assessments. Can you elaborate a little bit about the family assessment part?
I can't. Those numbers were provided to me by DSS. Is someone from DSS here who would like to?
Yeah, so I'll just briefly state, so what happens with family assessments is this is an opportunity, Thank you. With family assessments, it's an opportunity for the team to determine whether or not we can address some unmet social drivers of health and other factors that are affecting their family's ability to provide a safe home environment for their children.
I do want to say that those were numbers from DHS, not law enforcement and not the DA's office. So that's really unrelated to what we do with child cases.
All right, next up. So this says 2022 Cabarrus County child fatalities, and I want to explain that. Because even though this is 2024, we review our fatalities a year behind. So we are only right now reviewing the fatalities that occurred a year ago. Quite frankly, I wish it was not that way and we were reviewing more frequent and up-to-date cases, but we're not, because that is the way the state established these teams. First up, we had 29 fatalities in 2022. 11 of those cases were children who had some sort of birth defect or illness that absolutely nothing would have helped save those children. 8 children were victims of extreme prematurity. The state's new change, this is the only difference I'm expecting, is when they come out with this January 2025 statute, we are no longer going to be required to review premature infants, which makes sense. Although I will add, I have learned so much from reviewing premature infant cases. I've learned that a lot of times children are born prematurely the younger the mother is. If you have a mother who is 14 or 15, she is far statistically more likely to have a premature infant. That has been something that has been a red flag to us frequently about, is this a human trafficking case or is this an incest case that we didn't know anything about? And so Dr. Silver's knowledge of those cases and how a lot of those preemies originate is incredibly helpful. Accidental deaths. So we had one unsafe sleeping with an underlying medical condition, 2 children that were hit by vehicles, and 2 other cases that were just considered bona fide unsafe sleep. And so unsafe sleep is essentially where you fall asleep in some unsafe environment with your child. So you fall asleep on the couch with your baby space winds up in the sofa, baby suffocates. We've seen this in recliners. It's usually when the child, I've never seen a baby die when they were in a crib by themselves with a swaddler on. So, the hospital gives moms swaddle blankets now to put their infants in. If you're in a swaddle blanket with no stuffed animals or bumpers or anything, the baby's just in there asleep. We've never once had a child die from safe sleep. It's only the unsafe sleeping cases that we see. We've also got accidental and substance use affected. Unsafe sleep, we had a father who tested positive at the instance at the crime scene for methamphetamine. The mother tested positive for meth and marijuana. And then we've also had another unsafe sleep that was directly related to fentanyl toxicity. That goes to what I said earlier about there are some people who simply don't need to have a child because they are doing fentanyl around their children. We have had a substance abuse or a physical abuse related death, and then an unintentional self-harm by handgun discharge. And then we also had an overdose. In that suicide listing, there is actually another individual who did complete suicide who was a school student, but that child was just a few days past his 18th birthday. I've been doing these reports to you guys. I think this is my 10th or 11th year. I don't think I've reported on a suicide I don't know that I've reported on a suicide at all in that time period. We've had some children that have passed away with some questionable means, but we've never had a child complete. We have not had this. And so, essentially 2 children engaging in suicide with a handgun discharge doesn't seem like a lot, but the damage that causes to their family, their friends, their school, the whole environment is pretty high. And then we've also had another child who we believe was an accidental overdose at 16 years old. All right, Ashley and I are going to take a break because I want you to hear from some of my favorite people in the whole entire world. John, Amy, and Mackenzie are going to come up and talk to you about some school-related statistics, and then Ashley and I will be back with just a few minutes.
You can come join me if you want to. Yeah. Good afternoon, and thank you for having me. I usually do not have notes with me, but the numbers I'm going to report on are changing so rapidly. They changed since I left the office today, so I was trying to keep some notes here. Mackenzie, would you mind? Thank you. And I'm Amy Jewell. I'm the Director of Student and Family Support for Cabarrus County Schools. I oversee things like social work, homelessness, school mental health crisis response, among some other things. And I work very closely with these two here. So what I want to share with you today, and you may have heard a little bit over the last few weeks with some other presentations, is just the alarming rate of homeless students that we are supporting here in Cabarrus County Schools. So I will speak specifically for Cabarrus, and then I'll turn it over to Mackenzie to speak for Kannapolis City Schools. Last year, we ended the school year with about 740 homeless students for our school district. Right now, April 2nd, with a little over a month and a half to go, we are at 771 students or underage siblings that are homeless this year. 709 students we currently have in our school buildings. 56 of those students, or of that 71, are underage siblings, meaning they're not yet school age, but they are also homeless related to those students. And so we do have to also identify the underage siblings who are homeless so that we can do anything that we can with our partners to try to provide some early intervention and supportive services so that those students are equipped to enter school with us when they become school aged. So just to break that down a little bit, 511 of those students that I mentioned are doubled up, meaning they do not have their own fixed or stable or adequate housing, so they are staying either with another friend or family. Sometimes you hear that, like they're doubled up on a couch somewhere, perhaps. 198 of those students are in hotels or motels, sometimes in the area and sometimes in other counties, and we still serve them, of course. 37 are in shelters or transitional housing, and 16 of the students are reported today are they're unsheltered, meaning they do not have anywhere that they are sleeping at night. They may be in a car, they may be in a tent, they may be anywhere that you think about that is unsafe, not fixed, not adequate, and certainly not regular and safe for sleeping. We have amazing partners here in Cabarrus County, but these numbers are ones that we have never seen before, and they are growing exponentially. I heard Paula say we are the 10th largest growing county in North Carolina, because it's a wonderful place to be, right? It is an amazing place. We also lack affordable housing. We have families that are renting and maybe the house is sold from underneath them. Maybe their hotel room was locked. Maybe they were evicted. The last data that I got said that in Cabarrus County, we are looking at about 100 evictions per month. And under the McKinney-Vento Act, we have a duty to protect these students. And so when we qualify students as McKinney-Vento, they are federally protected, meaning if everything else in their life is really, really hard and unstable, we try to give them some stability in school. And that could be something as simple as, right, everybody gets free breakfast and lunch. But also, how do we work with transportation? How do we work with other cities and other counties if a family is temporarily staying with somebody in another county to make sure that their school environment stays stable and safe and they can get there every single day? And we can't just do that by saying, okay, you are McKinney-Vento. We have to work with the other counties. We have to work with child nutrition, transportation. Of course, our school social workers, they are the ones that are in our 45 schools identifying these students. It could be a self-report. It could be a community referral. But the social worker is reaching out to the parents or unaccompanied youth. Maybe they are a teenager who is of a family that we heard about earlier in this presentation, and their caretaker is unavailable to take care of them. So they are unaccompanied and they fall into this category as well. And so what do we do as a school system with our local partners to make sure that these children, because that's what they are safe and supported, they can get to school every single day? We work really closely with Cooperative Christian Ministry and Salvation Army. We have some grant funding that unfortunately will end during the next school year. So we work really closely with the studio and Esther's Heart for emergency funds, for emergency services, so that when we get a call at 5 or 6 p.m. on a Friday about a student family who maybe were locked out of their hotel or their apartment, could we shelter them for the weekend until we can get together and figure out something else for them on Monday? And so I could probably go on for a very, very long time. I just also want to say that I'm very grateful to our community partners for supporting our students. We could not serve them without our school social workers in our buildings. So we can come back to this, and I can certainly answer any questions you might have about this population in a little while, but I'd like to hand it over to Mackenzie to talk about Kannapolis City.
Sure. I don't know that I could follow it up with anything better than the way you've worded it. But I will let you know about Kannapolis City Schools. So obviously we're significantly smaller. We have 8 schools in our school district. And you'll see the numbers up there that we currently have identified 120 students as of February 14th. And when I go back and look, just as Amy said, we're identifying students every day. Just since that date, we've increased another 10, probably 20 students, and those are what's reported to us, right? So I always underline that these are very likely underreported, because often the last thing a parent wants to do is have to communicate with their child's teacher or someone at their school staff that they have lost housing. So those numbers are low. But when we compare to last school year, so again, it's about February, March, we've got quite a ways to go. We're already at higher than what we have seen last year. So I think we finished the year right around 120, and we're already over that for this school year. In working with our McKinney-Vento families and students closely, I have seen a shift in what we see. So the numbers are growing, but the way in which they're coming to us looks a lot different. As Amy mentioned, we're growing in evictions, and I always point out that this could be anyone. This could be one unfortunate situation away from us being in the same position. So that's something that we're seeing more often. Another thing that I've noticed is the increase in our students who are unsheltered. So in the past, I feel like a larger number was in that doubled up population. And something important to note is we talk about doubled up and sharing housing with someone else, but that could look like a family of 4 or more in one bedroom. So again, these are unstable and really often changing, but not ideal living circumstances. But I have seen more unsheltered looking like the cars and the sheds, which I think is harder and kind of points out the fact of the lack of emergency housing and support. So that's kind of what things look like in Kannapolis City Schools. And as Amy said, if you guys have any questions.
And before I kick it over to my colleague over there, John, who's going to talk about some really awesome intervention programming he's created, just also want to point out that homelessness is not its own trauma in a vacuum, right? It leads to a lot of other things. So you talk about unsafe housing or being doubled up or going to a shelter. Oftentimes that can mean exposure to perpetrators. It could mean having to cope with some really difficult things, or maybe you're looking at some substance use. You are potentially forced to make some really tough decisions about splitting up your family so that everybody could potentially find a bed or somewhere to rest their head. So when you talk about ACEs, and you talk about abuse, and you talk about trafficking, and we talk about substance abuse, and this is either an underlying factor or a contributing factor in a lot of those situations. It is certainly not the only thing. But I don't want to give any sort of false pretense or picture that this is something that could easily be solved. This affects everybody in our community, no matter what your role is, whether you're a business owner or you work in school or you're in public transportation or you're in child welfare or you're an advocacy agency. I mean, this really does touch all of us, and it is very impactful, I think, to every leg of the community. John, I will kick it over to you. Thank you.
I'm not sure. Well, thank you all for having me. I appreciate the chance to be able to talk to you about our response to substance misuse by young people. So the data on this screen, it looks, this is your data, right? This is KCS's data, right? So it's obviously very concerning when you see numbers like that. For us at Cabarrus County Schools, to this point, we've got.
Should be the next slide.
Oh, is that? Okay, great.
There you go.
So our data is actually, it's a little bit higher than this even currently. So we've had about 362 discipline referrals for tobacco, marijuana, and other substances, including alcohol. So essentially, if a young person comes to campus under the influence or is in possession of a substance, they can be referred for, they basically have a disciplinary referral for such instances. So one of the things I want to tell you about is some programming that we're doing that we've started this year, and we've done this exclusively through grant funding from the Concord Alcohol Board of Control. So some of you may know that there's a general statute. It's 18B 805, and then in item H, they specify that a percentage of what would be profit for ABC sales has to go to research, treatment, or alcohol substance abuse education. So the Concord Alcohol Board of Control fully funds 3 positions of 3 amazing people I have that are running these interventions as basically a mini school program. So one aspect of that is a program called PASS, which is the Positive Alternative to Student Suspension. We've modified that program to be an in-the-day suspension program that's voluntary. So the way that this works is when a student is found in possession or under the influence of a substance, they're suspended from school for 10 days, right? That means that they've got to be out of school for 10 days. And that's great for the school in a lot of ways. I don't know if it's so great for the parents, and I don't know if it's so great for the kid. So what we've done is we've developed a program where we've said to parents, we've partnered with parents to say, hey, if you bring your child to our program, we have a middle school program and a high school program. Over the next 10 days, we will make sure they're connected to their academic content. We'll give them prevention education through a program called the Project Towards No Drugs, which is an evidence-based curriculum. And we'll teach them some coping strategies to replace substance use, through a program called DBT in schools. So we basically run two, I guess you'd call it decision-making strategies with young people as well as academic time. And more importantly, perhaps, is those kids are in school with us. They're not at home being supervised by their parents who have to take off work, or more frequently, unsupervised by parents who couldn't take off of work. And let's just be honest with one another. If you have a kid who's gotten in trouble for a substance referral and they're unsupervised at home, what is it that they're doing, right? I mean, I don't think that they're necessarily, doubling down on their homework, right? The probability of them being in the street, unsupervised, doing something non-productive, or potentially engaging in substance use is high. So one of the things we've done is so far this year, we've served 177 middle and high school students through that program, through that PASS program. And I can't say enough about the great people who run that program. They're just fantastic people. They meet kids where they are, and they help them learn how to make some better decisions, to be able to mobilize some coping strategies. And so those are two of the three programs that we have developed this year, again, through Concord ABC's funding. The third program that we have is something called Recovery High School, and it's a very small program. When I say Recovery High School, we don't have a football team. Currently, it's one classroom. It's one classroom that we aspire to be able to serve about 8 to 10 kids in. Currently, we've just started the program, so our numbers are very few. But the idea there is that students can come to a safe environment where they can focus on recovery. They can focus on getting counseling services for them and their family, and to be in an environment where they can expect it to be substance-free, and again, be connected to their content, their academic content, while engaging in treatment. We're incredibly excited about those programs. Again, they're very new, but we feel really great about them. Thank you.
Okay, back over to you.
John, I have a question.
Sure.
Nice to see you. by the
Good to
way.
see you again,
It's been a while
sir.
since I've seen you.
Right.
But the programs that you're talking
Yes.
about, and you've got students obviously enrolled in each of those.
Sure,
And you take them as they come.
we do.
But do you have others that could get in it, but
Yeah.
you don't have facilities, or you don't have what
Yeah,
do you need, John?
that's a fantastic question. So what ends up happening, and this becomes basically an opt-in program, right? So as I tell you about these, you can do the math. I said 177 students we've served. We've had about 362 referrals. That's about 48%. It's just under half of the students actually show up. And so part of that, there's a lot of issues. Some parents, I think, face transportation issues. Very frankly, it's difficult for a school district to turn on a dime and be able to bring students to our center. In other words, it's hard to set up a bus from any single address and turn it like that to be able to come to our program. So transportation, I think, is a factor. I think there's probably some parental unawareness or suspicion, or you've probably heard me talk about institutional distrust before, that people just don't know they can trust us yet fully. So I think the second part will come over time. But the transportation, I think, is a huge barrier for some families.
Well, I just remember from my school board days, and I thought it was just totally astounding that we had 300 students that were considered homeless.
Yeah.
And to see that it's more than double that, but then, and of course, the school population has not doubled.
Yeah.
But this particular situation has. And so that's alarming to me.
Yeah.
And, the question that I always have when it comes to this is, what more can we do? What more can you do? What can your staff do? What resources do you need? How can we help you?
Do you want to take that?
Again, it's a big question,
Yeah.
and I know you're going to make some recommendations here in a little bit. It is all about connecting with these families and getting resources, and so we have these amazing partnerships. I think what our current agencies can only handle so much, just the infrastructure. The Salvation Army opening their new shelter is amazing. We have a couple families now that can stay together. We are heading in the right direction, but we are still way behind. I mentioned before, we rely really heavily on our social workers and our transportation department to make sure that all these kids and families can be identified and get to school, and we're still lacking there, right? So anyone who's worked with me over the last decade know I talk a lot about ratios, and to me that means direct service. So if The recommended ratio for social worker to work in a school and identify students who need additional support is about 1 social worker to every 250 students. 1 to 50 in like a very high need school where we have a very high homeless population. We are currently sitting at about 1 to 1,100 or 1 to 1,200. Again, we are going in the right direction. When I came to Cabarrus County in 2013, I think we had, John, 11 social workers? We have 34 now. So I want to thank the county because we are out there and people are hearing us, and I think that we are going in the right direction. There's a lot of support, but we still we're not there yet. We need more, I think, human resources to be able to really pull together, not just for us in the school district, but be able to reach out to our advocacy agencies and DHS and our nonprofits to be able to wrap around these families and make sure that they are stable and safe enough until they can really get back on their feet and get where they need to be. Nobody chooses that for their family, right? So, thank you for the
I would
question.
echo that as well. When we talk about like the underreported numbers of McKinney-Vento students, part of that is having more of the human resources to be in closer touch with the families and students that attend their school. And then some of it is about having those human resources to be more on a preventative measure. So if there's ways to link these families to resources out there that could be preventative to losing housing, part of that is getting ahead of the problem and being able to identify it early. So I think sometimes if we had an increase in those services and the staffing, that would be one way.
And I know housing is a big topic and affordable housing, and so I won't go all the way down that road. Yes, it goes hand in hand, and it impacts, again, every aspect of when we talk about the safety of the children in this county. Housing is a huge issue, safe and affordable housing that can keep our kids safe. That's a really large barrier right now, because even if we get all those human resources, we need a place that we can send these families who will accept them as family units, with people who will work with them no matter what stage, right, of life that they are in, so.
Can I add something? I want to speak on something. First of all, I'd like to thank you guys. I mean, it's obvious how passionate you guys are, all of you, and how we're so fortunate in this county to have people like you guys. But one of the things, and it's good seeing John and Amy, and it's good seeing John and not talking about COVID. He about drove me nuts, but anyway, that was a long time ago.
Gonna haunt you forever.
Right, exactly.
But, no, seriously, can you kind of expound a little bit on how important, or what the roles teachers play? Because, just like you said, parents are kind of embarrassed, don't want to come forward, and how the school system has, I think you've trained, or teachers have trained in how to notice some of these things, and they're really on the front lines every day, probably working hand in hand with you guys, noticing things that gets brought to your attention.
Yeah, absolutely. So our teachers are the backbone of everything that happens in this county. They are with our children, right, more than we are. I have 2 children in Cabarrus County schools, and I've been really lucky that their teachers have been amazing, and I trust their schools. But for me, being on the inside, seeing the amazing work that their teachers in schools do, it's easier for me to have that trust. I think if you look at our teachers and just the demands that are put on them, they're all there because they want to make a positive difference in the life of a child. There is no other reason that an educator goes into this field. It is not easy. And so we do everything we can to support them. And so, yes, that starts with preliminary training, that's onboarding. And we don't ask them to step out of their role as a teacher and be an interventionist. We train on just recognizing the signs, and that can be symptoms of abuse and neglect, and we do that every year, multiple times a year. It's the same for human trafficking and for homelessness as well. So we have a McKinney-Vento specialist for our district. One position used to be enough there, but as you see the numbers, that it's becoming its own entity now. And so really making sure that we are dispelling myths and stereotypes of what homelessness looks like, especially in an area like Cabarrus County. And so just training our teachers what to recognize, potential questions to ask, but then really about utilizing the other resources that are in their building. So can you go to your school counselor, school social worker, school psychologist and say, hey, something's going on with Mackenzie over here. I'm not feeling great about it. Do you think you could check in? And making sure that that teacher knows that they do not have to solve all of that, that they have a plethora of resources within their building who they can hand off to safely and potentially confidentially as well. It's a really difficult subject to broach with families. Like Mackenzie mentioned before, there's a sense of shame with it, right? Nobody wants to be homeless. Nobody wants to have these housing difficulties. And so just leading those conversations in a very safe and supportive way and letting the parents really lead that conversation of what they're willing to discuss. And then on the opposite end, if we identify these students and we're providing interventions, making sure that the teachers know enough about what that might look like in the classroom. Again, they don't have to call it out. They don't have to know all the details of what's going on with this family who might be doubled up or staying at a hotel, but just knowing, hey, Mackenzie's not in a great situation outside of school. Can we give some leeway? Can we get one of the McKinney-Vento tutors that we fund to make sure that they're meeting before or after school? Are we making sure that they're being dropped off and picked up in a safe location that might not stigmatize the student? And so we do just a lot of training there and letting know that our teachers, they are eyes and ears of every student in the building. And so helping them feel supported by the other support staff and knowing that they can go to them to do that deeper dive, also to not jeopardize the relationship the teacher has with the student.
John, I want you to stay.
Okay, very good.
Thank you so much.
One of the things, and Commissioner Furr, I appreciated your question. Without the support of our teachers, I don't think any of our team would be as successful as we are. And this is something that those in the school system know, but I don't know if others do. So when Hannah Airwood and Present Age Ministries developed a curriculum for the schools to talk with students about making sure that they're safe from sexual and physical harm, we in our world know that as soon as that curriculum goes out, there's going to be tons of children who are going to go forward. We see it every year. For law enforcement in my office, I can time my sex offense cases to the beginning and end of the school year because students feel safe to tell their teachers what happened. And so we're so grateful for them. And I love the partnership we have with our school system, and I love Hannah Airwood's curriculum. It's wonderful.
Also, if you're feeling somewhat inspired despite the content that we're talking about, that's one of the reasons that I love this team, because I usually leave feeling some sort of hope that these problems have some form of a solution, or that at least Amy Jewell is sitting somewhere thinking about what she can do to help with this stuff. And she's usually basically a rock star. Last year, we went over some action items of these are things that we recognize are not necessarily within your purview as commissioners, but you all speak to senators and House reps and do advocacy all the time, usually in a very productive and helpful way. And so these are our action items for this year. I'm going to let you go with the first one.
When I met with the school principals and asked what was the #1 issue you were seeing as far as our worlds collide, and all of them were universal in that we have these vapes that are sold by all types of things, or perhaps these children are getting them, but we don't know what's in them. And there are some that are very reliable, and then there are some offenders out there who want to push things to children that are not. And we're having episodes, especially for whatever reason, it seems the young girls, when they use these vapes, many of them are becoming so sick that they're having to get hospital treatment. I don't know, I would have to have our medical staff tell us about that. Is that because maybe young girls are a little smaller, so these effects are having a little, but whatever. We need some type, though, of equipment to testify the THC levels. If it is less than 3%, it's legal. But if it's more than 3%, then it is not. But right now, the state of North Carolina does not have testing for those vapes. So law enforcement is asked by the principals, come out and do something about this. But if we don't show that the vape is illegal, there's nothing they can do. And so I even had someone at school say, is it possible that we could get some type of lab that could test that? And so I think that is something that I would ask you as commissioners for the bully pulpit, that we need our state lab to obtain the equipment so we can see what are our children, what are they doing, what are they using? And if it is illegal, and we all suspect in our community that it is, then we could stop it.
Ashley, I have a question for you. I guess people can get what they want, when they want it, and how they want it, whatever. But it seems to me like, though, that, because I know of cases where that anybody can go in a vape store and buy the vapes. What's being done, and this might be a question for law enforcement, how are we finding out who's illegally selling the vapes, number one? And, and get them out of the business or terminate their permit or whatever is required. But there has to be a source of the product somewhere. And if we got illegal sellers, or what I'd imagine you have to be 18 to buy the vape. I don't know nothing about that stuff.
See, it depends on what it is, because if it's not over 3%, you don't necessarily have to be over 18. I think that's our issue. For law enforcement, if they go into a shop that's selling these vapes, they can't tell you, is it legal or is it not, because the state lab doesn't test it. There are, though, private labs that do. And so law enforcement is, in particular cases, sending to private labs. But you fund the sheriff's department, we have Concord Police Department, they have so many needs, and they have to, how much money can we spend on this private lab piece? When, frankly, I think it's just a piece of equipment that the state lab needs to get. And I think if they hear enough communities saying, listen, let's get that equipment statewide so all communities can benefit, I think they would do it.
I agree, and I think that we do have legislative support to get something like that done. But then again, my question is, how do you put these dealers out of business? When they come in and they want to buy a vape, it doesn't really matter about the THC content. This is just a vape in general.
I think what would happen if we had the labs, then law enforcement could go in, or anyone could go in, purchase it, send it off. If it's above 3%, that's a crime, and then we shut you down.
Yeah.
The problem is we can't make that determination right now. So even though we believe a number of these stores are selling items, not everything, that are over that 3%, we can't prove it. And that if we had that lab, I think this would be a very quick case. They'd go in, anybody, you wouldn't even have to have a warrant. Just go purchase it like anybody else, send it off, there you go. You're selling something that's illegal.
But if they're selling vapes that are legal,
That's right.
is there an age limit on that?
There's not.
Huh, okay, well, that's part of the problem
And,
right there.
and that needs to happen too. I mean, frankly, I think if we just had a law that says it's illegal to sell a vape at a school, regardless of what's in it. Because I don't think children should be selling anything else to another child, because they don't know if it's harmful or not. I think if that was a law, that would be very easy to shut down too, regardless of what's in it. Don't sell something to another child that you don't know what it is.
Right.
Yeah.
Well, I think, Mr. Chairman, we ought to be able to come up with something, to get our local delegation to help us acquire a lab to test for THC. Would that be located in any specific place?
Well, actually, last year we were here and we asked for our own medical examiner's office. There was a bill that was being proposed with Wingate College in Union County, and that passed. So we are going to have now a medical examiner's office that our district, our counties can use instead of taking everyone up to Chapel Hill. There was a proposal, could we get a lab to locate there? Because with the ME's office, there is a need to test the victim and test the others. Could we co-locate it there?
Right.
That would be an easy proposal to me, since this other lab is, or this facility is going to be built.
Well, one thing about it, North Carolina's got what they refer to as a rainy day fund. And this is, to me, important enough that we ought to try to do something from this Board of Commissioners to the local delegation and try to push it forward for funding for this. I would certainly approve that, or would like to see us do that. I don't know how the others feel, but I feel like they're probably the same way. It's an issue that we need to deal with. We can talk about it all day and year after year after year, but talking don't get it done. We need to put some action behind our words and do what we can, and I'm willing to do whatever we have to get the funding for it.
I think that's a couple of the items that I've made note of here, and we met with our entire legislative delegation just about 3-4 weeks ago, and made a number of requests. This was not on that list because we didn't have awareness of it. So I guess one of the questions that I would ask is, what does a lab cost? Is that, I have no, I don't know if it costs $50,000 or $5 million. I don't know that you would necessarily.
Well, one of the, I don't know the cost, but I will say this, there is a piece to get some offset, because under our law, when someone is violating the narcotics laws and they are charged, part of their punishment is they have to pay for the lab fee.
Okay.
And so that's not going to be a wash. I'm not saying that's going to be equal, but there is some offset there. And so I think that could be a benefit, but I don't know the cost. I know the legislature does. And,
Well, and certainly that, I mean, we talked about the medical examiner, and that was one of the items
Yes, it
that
was.
was on our list last year, and we're,
Yes.
like, I think you, very pleased that
That's
that
right.
has worked out, and that's certainly something we can pursue. The other question I had is, are you telling me that there's a age restriction to purchase cigarettes of 18 years old, age restriction to purchase alcohol 21 years old, but there's no age restriction to buy a vape product?
And it's because what the defense is we don't know what's in it. This could just be candy for all you know. It could be this. That's why we need the
Flavor
test.
matter.
Yeah.
That's it. It's, yes, if we could prove it's 3% or above, then no one can purchase it. And then perhaps there is other offenses about minors purchasing, delivering to minors. That's a higher level offense. We'd have a whole field day of charges. We have to prove that it is illegal, and that's the one key we're missing, is that lab equipment.
But has it not been, I mean, it's been established that cigarettes are not healthy for consumption.
Right.
Is the same thing not true of vapes, of any product?
No, just it has to have THC with over 3%.
Okay.
That has been deemed harmful.
But the healthcare community might have a different opinion.
That's right.
But the legal community,
That's right.
okay,
That's right. For it to be actionable as a crime, I
Right.
need it to be a 3% or more.
right.
Yeah.
So we need to test it. Next up,
Wait a minute.
Sure.
We got to get a little bit deeper on this.
no problem.
I would like to find out what it would cost actually for the THC lab,
All
number
right.
one. And number two, Rich, the opioid settlement that we got, those funds that come in that we get for the next 18 years, could some of that money go toward funding the THC lab, and we do it locally?
Get this on.
These buttons are hard to push, guys.
Doesn't push
Are you-
above the
you-
button.
you go.
You push above the button, not on
Yeah.
the button. And I'm not exactly sure. All I can tell you is that on the opioid settlement, the funds are restricted to certain things. And there's actually kind of a range of items that you can spend them on. But whether something like this would fit within any of those, I couldn't tell you without looking at the settlement to see exactly what it said.
Well, the reason I ask you that, Rich, is because, as we all know, it's sort of like a stepping stone. You start here, and then whatever you get from here, you have to go to something else. And then you go to something else, on and on and on. And then, it could turn into an actual opioid situation at some point, starting just from a simple vape. So that's the reason I was asking if we could maybe use some of the opioid funds to fund the THC lab and let us just do it for Cabarrus County.
Well, maybe, but what I would tell you is that the history of that litigation from the start until when it's been settled, and there are actually still settlements going on with different manufacturers and distributors, that basically it started out, and at the point that it is now, was always about opioids. So, this part about maybe it's starting, looking at starting with some sort of substance that was lesser in terms of the way it was, people use it, and then moving up to those. It really didn't, it didn't really include that I've seen. It's always been opioids, and that's it. So I would have to say that, I just don't know, like I say, without looking at, because the documents are very specific about what you can do. So we can certainly look at it and see if there is some room to maybe include something that would be in this area.
Okay, well, if Ashley can get us some information about the THC lab, and then if you can find out about whether we can use it or not, it might be something that we could put back on an agenda in a couple of months, maybe in May or June for sure, and so that we can try to get some type of resolution to what we're gonna do, if anything.
So Commissioner, I'll tag team if that's okay with the attorney. So we do have the outcome of our collaborative strategic planning process. In fact, we have another meeting scheduled later this week where they're going to talk about the recommendations from that process, and that will be coming back before this board before the end of this fiscal year. So that there will be an opportunity for us to have those conversations. And just as he mentioned, there does have to be a tie to opioid use disorders in some form or fashion. So that would be the big question as to whether or not we could use the settlement funds for this purpose.
Yeah, well, that's what I would be interested in, and then if we find out that the funds cannot be used, then the next question would be, could Cabarrus County do it on its own without the use of the opioid funds? And then if that didn't work, then we could push on to the state for state funds to do it. But the thing that I want most of all is I don't want this to just drop when this meeting's done. I don't want us just to forget about what you told us. I want us to stick in our minds to what we can do, because if it's something that's going to help the kids, then it's going to help us down the road, because they won't be across the street somewhere,
For sure.
or worse. So, but anyway, I'll hush up now. That's just my take on it.
We appreciate you, Lynn.
How much is the fee for the lab?
It's $500 or $600, depending on which testing we do.
So if we could do it locally, it could possibly be a money generator to charge other local communities to use our stuff, correct?
It could, let me just say this, and I know Mr. White's here, he could probably tell you a little bit too. Not all of the offenders pay the fee, and then they go to jail. So it's not that you get the money from each defendant, but you get them as possible. But yes, and frankly, I think if you did this regional lab, we've been advocating that for a long time. If you did a regional lab, you would have Stanley, Iredell, Rowan, Union, and Cabarrus, and we would all do it. It's not only just the fact that we have to pay, this testing doesn't exist. When I send items to the state lab now, I'm waiting a year for the results. If we had a regional lab, imagine the timepiece. But I will be happy to get whatever information I can to help.
John, I believe you had something to add.
Sure, if I can make this work. I don't think I can. So from your position, you all have a lot of influence in this community. And one thing I would say, in addition to the lab piece of it, if you really want to garner support for something like the lab, just mobilize parents. I mean, the best way to mobilize parents, I think, is ask them to do a tour of their vape shop. Spend 10 minutes in there, figure out their local vape shop, figure out who's walking in and who's walking out, what they're selling, what they're getting. Do they, as parents, know what their kids have just bought? If that doesn't unsettle you, I don't know what will.
Thanks, John. Next up, but thank you. That was a wonderful discussion. It was very productive. We also, as we've shown you, our homelessness data, and we've also shown you the fatality data, which included those suicides that we've not had in many, many, many years. We need more social workers. We need more highly trained DHS social workers. We also need more school social workers. One of the things that you asked earlier is kind of like, well, what do we do about this homelessness problem? And that is a conversation that I have had with our team, but I've also had that with individuals in other cities. One of my college friends is a city councilwoman in Lexington, Kentucky, and they have similar problems, just predominantly with a college-based population. If you go to any major city, New Orleans, San Francisco, Salt Lake City, you see similar circumstances of just homeless people, including homeless children in tent cities everywhere. I do not know what the answer to that is. I think that we have become a big city with big city problems, and this is a subset of having a big city problem. That is a true statement, and it is also a true statement that no child should have to live that way. No child signs up to be homeless or live in poverty, and none of their parents want that environment for them either. So I think we need to do the best that we can to make sure that Amy and John and that the folks at DHS have what they need in order to provide services when they have children like that, because it is a hopeless feeling for our professionals day in and day out who see this and deal with it every day. And giving them an increase in competent quality numbers will help their work as well. Number 3, we need an evidence-based treatment plan for substance use involving juveniles. As you guys have seen from those numbers, substance use among our children is very real, it is very disturbing, and it is getting worse. We really don't have a treatment facility for minors in the state of North Carolina. If you are 14 and need to go to rehab, you're headed to South Carolina because that doesn't exist here. So evidence-based treatment for substance use involving juveniles is important. And then number 4, we've already kind of this is why I asked John to stay up here. We need the support for this recovery high school, because in view of the fact that we don't have a lot of assistance for evidence-based treatment for substance use involving the kids, we need to be able to give them something, and that recovery high school is one of the best things that we can probably have. John, would you like to add anything to those 2 points?
I think I'd say that obviously in the schools, we can't provide treatment, right? We're not a therapeutic provider. We're not a substitute for a residential or even an outpatient facility, but we can work hand in hand with those folks. We can make referrals and we can support the students for sure. But as we become a larger community, as we embrace the identity of being a bigger city, it certainly would make sense for us to be able to locally refer young people to get the treatment they need in an evidence-based fashion.
All right, I think that we are all done unless you all have any additional questions about anything.
I don't have a question, more of a statement. You guys have spent an hour and 15 minutes justifying this to us. It's obvious we need it. It also comes down to money. So you guys gave us what you need, now I'll give you what we need. We need you to be our biggest cheerleaders too. I have zero problem standing and being your biggest cheerleader for this because we need it. It's there. The school system needs it. Anybody that has kids in school knows it. I have 4 that are still in school. Vaping is a nightmare, and it affects everybody. We fight it in our house the same as any other high school parent fights it in their house. But at the end of the day, we can't cut everything down to bare minimum and still be able to give you guys what you need to be able to protect the children. Like I said, I have zero problem being your biggest cheerleader, but we also need the word to get out as well that we can't cut everything down to bare bones and still be able to help the kids in this community, because as our first speaker said, that's what's most important. They are our future, so that's.
I had a couple of comments to make as well, and surprisingly, very much in line with what Commissioner Workman just said. But first of all, thank you, Hannah, for those opening comments. I've been very aware of the work of your organization and what you've done, and it's tremendous that we have that resource available. It is, I would say we could be very proud of what you do, but I'm not proud because we shouldn't need to do those things. But thank goodness we have that resource. And you said, you know, how are the children doing? And you said, what are we doing? Question. You didn't answer that question. And so my question, which has partially been answered, is what should we be doing? What should we be doing that we are not doing? And you've given several answers to that. You may have additional ones as well. We talked about the lab, and I agree with Commissioner Shue. I think that's certainly something that we can advocate for and we can learn more about and find out just what is required. I'm over the moon thrilled that all of you seem to be pleased with the outcome of the medical examiner's office. And that wasn't something that we selfishly asked for Cabarrus County. That was a regional thing, a collaborative thing that I think is going to benefit everybody. I'm glad to hear that you still think so. If it doesn't, we can revisit it. We can come up with a different plan. I'd asked the question earlier, how much money does a lab cost? Sometimes these things are surprisingly more affordable than I might have realized. Sometimes it goes the other way, and so that's certainly something we can find out about. I asked the question earlier about the legal age for vaping, which comes as a surprise to me. I had no idea that was totally unregulated unless the levels were above legal. You talked about needing more human resources. And of course, I'm very proud, and I think Amy mentioned in her comments that we went from 0 to 11 to 30 social workers in the schools, and I fully understand, and I paid careful attention to those ratios that were mentioned, and that's not nearly enough. Everything else or much of what we do as a board, the companies that we try to recruit into Cabarrus County are to benefit I think, 1,600 students that are going to be graduating from high school within the next month here in Cabarrus County. And so, those are the things that we find are very important. We try to provide opportunities for those students to have fulfilling careers, to stay in the community. And we do that, all of us, do that every single year. I mean, the number keeps growing, 1,600 every single year. That's a lot of people to put out in the workforce. And that's one of the reasons that we've placed a lot of importance on that. To go back to what Commissioner Wortman says, there's a huge disconnect here. And one of the things that I wrote down here is, why are you giving this report now? And why is this report not given at our regular meeting? Well, I think I know the answer to that. It's because our standard operating procedure is that we have these type of matters that we discuss at work session. Truth of the matter is, and these are televised, all of our meetings are televised, they're available on YouTube, there's multiple different opportunities for people to see them. Typically, they don't pay as much attention to the work sessions, which is totally opposite of the way it should be, because this is where we really talk about these kind of important issues and the details. But they do watch our regular meetings, and they show up for our regular meetings because they get 3 minutes to talk on camera. And so that's where we have a group of people that come in that say all the opposite things of what we're hearing here today. That is where we have people that come in and talk about our Department of Human Services and talk about child protective custody in a very negative way, they don't hear the things that we've heard here today. And this is not you giving your opinion about anything. These are actual facts and cases and statistics. And so those people that are coming, making those kind of statements need to hear these facts at the same time. And I'm very serious about that. I'm not sure exactly, maybe if we could come up with a condensed version of this report. I don't think it needs to be all that condensed because time is one thing we've got time. We can do that. But I think that this report should be heard in our regular meeting for people to hear. And at the same time, we're talking about human resources, we're talking about social workers in the schools. Those are, it's a little flippant to say simple problems to solve. All it takes is money. But that's the same forum where we've had, for our last 2 regular meetings, multitudes of people coming in a very planned fashion, including applause and so forth and so on, to talk about talk about how their taxes are spent. And so, from the chair that I sit in, and when I hear these kind of facts and the impacts that we can have on children's lives and families' lives with how we spend our resources, it's pretty important things. I think that sometimes it's difficult for us to look people in the eye and say, are you telling me that you don't think it's important for children to have these resources in school, and on and on? And the homeless situation, the affordable housing situation, those are all things that we talk about, and we constantly look for solutions. And I feel like I've done a good job of partnering with community organizations like you've mentioned earlier, the Salvation Army, Cooperative Christian Ministries, We Build Concord, which is looking at affordable housing issues. We've tried to direct resources to those organizations that we feel like will make a difference in improving some of those. But I don't think any of it is unique to Cabarrus County. I mean, when I look all around, and I've been to, I visited a project in Texas this past summer to see how they were handling some of these situations. It's all, we all have the same problems. And so surely one of us is going to come up with I hate to use the word magical solution, but that's what it seems like it needs to be. But I think for us to have these conversations is really important. I think for more people to hear these conversations and to hear these facts and figures and to understand these things are happening right here in your community, in your neighborhood, in your child's school every single day. And I don't think people really grasp that. And so I'm not sure how we make that happen. But thank you for what all of you do. And I want to go back and have that conversation about how we include this in our regular meeting agenda, for sure.
Give me a date. I've never, ever been shy about showing up anywhere and talking about child welfare. I don't care when it is. Give me a date, I'll show up.
Yeah. Well, sometimes I think we hear one side of the story, and it's good to hear the full spectrum. And for people that tune in once a month and watch that regular meeting, and I think at our last meeting, I watched what appeared to be a well-orchestrated and planned YouTube video, including protest on the street and so forth and so on. We need to make sure they hear the other side of that issue as well. But as far as the child protection team, the child fatality team, and I had this conversation with Paula within the last 24 hours, I think. As I was, we've had discussion about the appointments to those and so forth and so on. We talked about it at our retreat, you know, and I want it to be clear to the public that that is in no way any expression of any dissatisfaction or anything other than appreciation for what all of you, and those of you that are involved that not 100% are here, but is very, very appreciated and recognized. And so, you know, it kind of dawned, I thought, no, so why are we having this conversation? And I found a piece of legislation that I had printed out in October of last year. And I think it was proposed legislation. It's probably what you had talked about here that said you must do this, that, and the other thing. And we talked about it at our retreat, and my response was, not a problem. We've got the people, we've got the positions, just tell us what we need to vote on to make it official. So I didn't view that as a problem. I still don't view it as a problem. I don't think anybody on this board has any concern other than doing what we need to do to support continuing the efforts that are already underway. So thank you all very much for what you do, not only the time that you have spent with us here tonight, but what you do every month. It's not a matter that the average person wants to deal with, or even in some cases, even hear about. But I think it's incumbent upon all of us, certainly as elected officials, that's part of our responsibility to do everything that we can to protect the children and to know how they are. And I was serious about my earlier question, responding to Hannah, you know, what should we be doing that we're not doing in addition to these things? And certainly, you know, if we can use this as a forum to create awareness and impact, and I think it's always beneficial for our, you know, I think that the majority of our taxpayers out in the county, they probably don't have a conscious realization that is where their funds are being used, a lot of their funds. They don't realize that those social workers and those positions in the school system, that's what funds those. That's where that comes from. So I think we all can do a better job of trying to educate folks about the importance. And so you've done a great deal in that regard by being here today.
So just so you know, that list that we give you at the end, that list is a whole, usually hour-long discussion that our team comes up with, because we usually have a whole whiteboard full of ideas that answer the question of what are some things we could be doing, but we also know we can't keep you here until midnight.
Right.
And so we boil it down every year, and we try to pick what are the most important, most impactful things. And usually when we give you things like that, there is a child behind those things that we just can't tell you about because of our confidentiality agreements. But every single one of those things, we have an anecdotal story of an actual child in this county that is the reason that we're asking for those things. And those children are why those action items come into existence. So those 4 things are not stuff that we just kind of happenstance throughout there. Like, there is even sometimes inner fighting within our team, figuring out what are we going to give you guys that is going to be the most productive and the most helpful. If you wanted to hear the unabridged version, which we would welcome, I will set aside a whole child protection team meeting where you can come for 2 hours, and we will do nothing but answer the questions for you of what do we need. I could tell the team to bring everything they have, and you could hear it from every single individual in every single discipline. What do we need? Because what law enforcement is going to tell you is the most important. It's going to be different from EMS. It's going to be different from the school system. But all of the things that each of those organizations need is going to benefit everybody else.
I accept your invitation, and
I
I
do as
hope
well.
that others will as well, because to hear that unabridged discussion, I think, creates tremendous awareness that may not otherwise exist. And the one thing that we as commissioners, as elected officials can do that doesn't cost anything is to talk. And we can talk a lot, and we can talk to a lot of people. And so to have the knowledge and the ability to share some of those specific circumstances, and it doesn't have to have a name attached to it. We can just say, this child, I think is extremely valuable. So, yeah, I would welcome that opportunity and would encourage other commissioners to do it as well.
I will get you our May date. Our April date might be a little too soon for you, and we're doing fatalities in April, but I will get you a May date, and we would welcome you. That will give my team a good 8 weeks to put our action items list together, and we'll have a lot to share with you that day. That would be wonderful.
Excellent.
And Chairman Morris, I would also say, you guys said you've been ahead of the curve with your team. You've been doing for 10 years now, whatever the statute is. And I would really like the number for that lab, because our budget process is going on. I've had the conversation with Chairman Morris before, and I know you agree. Any chance we get to lead instead of follow the example of another county, I think this is possibly a great opportunity for us to set the bar in Cabarrus County to lead. And very few times will you hear somebody state exactly where they stand. I want to lead. And I'm very interested in that price, because I think we can set the bar for everybody else to follow.
Right.
Thank you.
And also, Mr. Chairman, my final comment on this is, whenever we do schedule that meeting with your team, that to further educate the citizens of the county, to have that particular forum televised.
Yeah, we can't televise a child protection
Well,
team
you can
meeting.
leave the names out, can you?
No, we couldn't do that.
Okay, well, that solves that.
I think we can work with them to get this information at a regular meeting.
Would that have to be 2 on 2s though?
No, I'm saying, to the child protection team,
For
yeah.
all of us to attend.
Couldn't be more than 2 of us to attend one of those meetings, so we'd have to split that up.
Yeah.
Correct. It's not an open meeting, so it wouldn't, the whole board couldn't attend.
Right.
Now, that wouldn't prohibit you two from going to May. Also, one of the things we need to do later on tonight is one of the 5 of you needs to be on that team.
Right.
Because you are the Consolidated Human Services
We already
Board.
discussed that.
Yeah.
I deal with death for a living. That's what I do.
Yeah,
And I have no problem.
yeah. So we're,
Well, one of the issues that we always have is how do you get the information, and you hit on it, Steve, you got 2 sides. And unfortunately, the side that don't know is the ones that comes to talk all the time. And I would like for everybody to hear this instead of a certain side. Because, we face the challenge of budgeting all of these things. And of course, when you, just like last month, the board approved a $9.5 million increase to the sheriff's office. And we already looking at a deficit at revenue neutral. So why, or how do we overcome that? We need the people to understand. They need to know the challenges that we face with their money. And that's the only reason that I wanted to see us televise it, so that more people could be educated about what we're doing and why we're doing it. I mean, we don't just pull this stuff out of the air, just like you didn't pull this stuff out of the air. And, but we hear a lot of reports every month, and some of them, don't grasp you quite as much as others. This is one that gets you, because it's the children. And, the children really are, I know it's been said several times, but the children's our greatest asset. And so if we don't protect them, who's going to? And so we need to do everything we can. And but if we could find out a way that we could televise it, Mr. Chairman, I don't know.
Well, I think we can continue to discuss it and work on it, for sure. So thank you.
Thank you. Thank you.
All of you. Okay, we have one more item on our section of discussion items for no action. So we'll go ahead and do item 3.2, which is an Afton Library update. After that, we will take a short break for about 15 minutes and then come back for discussion items for action. So I'll turn the floor over to Kelly and Michael. Welcome.
Thank you. This will be quick. We wanted to give you a couple of quick updates on the Afton Library project. So we broke out the outdoor amenity package in order to move the project along. We received the amount on that, and we've been value engineering it down. We think we're going to be around $900,000 on that. We're still checking out the fencing that they provided as an option. We also have an outstanding issue of the turn lane and traffic impact analysis. But right now, we believe we can fit all that in the budget that we have. So this is just an update on that front. And then Michael's going to give you a quick update on where we're at with the actual building.
Yeah, I'll give you an update on the current status of construction out there on site. The building steel has been fully erected. The exterior framing and sheathing is approximately 90% complete. The waterproofing around the building is about 30% complete. The parking lot is being graded out right now in preparation to install the curb and gutter. So kind of identify the islands and the edges of the parking lots and things like that next week. And inside the building, the overhead mechanical, electrical, plumbing, and fire protection work has begun. And then moving forward over the next month or so, we'll start framing inside the building. The roof work will begin. The interior wall, electrical, and plumbing rough-ends will begin. And the window installation will begin, and the curb and gutter will be complete in the parking lot. So at that point, we'll be pretty much dried in.
And we are on schedule still for February 25.
Very good. So February of '25 will be actual opening date.
Currently, that is the goal. Yes.
Yes, yeah, well, that's not far away.
No, it's moving along quickly.
Yeah. Questions for Kelly or Michael?
Okay.
All right, thank you very much. And as I mentioned before, we will take about a 15-minute break, and we will reconvene at 5 minutes until 6.
To add this to the agenda.
Yeah. Their presentation, yeah.
We might want to make sure that the date works for Paula, but otherwise.
She just said it did.
Steve, did you get the feeling that they were a little bit
Adversarial?
well, a little bit.
Did you get the feeling that I was addressing that back to them?
Well, you did indirectly,
Yeah.
but no, I mean, they've been working with Evan on that statute, and they've been very resistant to him on that. And but particularly Ashley said something.
Oh, yeah, without interfering.
Yeah.
But, yeah,
And he's just following the statute. We're not trying.
that's the reason that I mentioned that I had looked at the statute and this is not something new.
Just trying to do what we're supposed to do and get that straight. It wasn't really, what they took it as they had to circle the wagons.
Yeah, I think so. Well, I think we are going to get started. Okay, I think it is 5 till, so it's time for us to reconvene.
Study group over.
And so we will begin with item 4.1 from Active Living in Parks, Ordinance Update. We're happy to have Londa Strong for that item. Welcome.
Thank you. I think most of y'all are aware of the ordinance that governs everything in Cabarrus County. Chapter 50 is active living in parks, and we wanted to do an update to try to help expand the use of personal pop-up tents in the parks so that they're safe. We've met with RISC and had Mr. Lee to wordsmith this versus what I had written in with the ALP Commission. Also reviewed it, and they actually had more things that they wanted to stick in here, but we wanted to have something that where we could actually make sure that it was happening. Fire marshal, we met with them, and there were certain things that we could and couldn't do, and based on the size of the tent, what you can and can't do. So what we are proposing would be to allow personal pop-up tents using weights of either looks like a weight room weight that goes around the leg, or a sandbag. No stakes whatsoever, so there's no wires, no strings, no cords, no anything for anybody to trip on. There were a lot of regulations from the fire marshal where you couldn't tether them together. And I think a lot of that was for safety, because they were talking about using the same weight on 2 poles, 2 legs. We said no. But the fire marshal said, that extends the square feet, and based on the square feet is whether you have to have in permits and inspections. And so that would be with commercial tents that would come in for us, the over 800 square feet, under 800 square feet, those things. That's taken care of by a commercial group coming in. But personal pop-up tents for events, ball games, there'd be specific areas, so you couldn't just come out and have a shelter reserved and decide to stick you a pop-up tent in a certain area, just like we have regulations where you can bring a grill, but it has to be in a specific area. So we wouldn't just have pop-up tents everywhere. And the maps would be made for each facility that showed the specific areas. The ball fields and special events are the main issues that we have. Like Positively Midland is getting ready to have something at Rob Wallace Park, and the vendors want to have them. So because of that, I would like to ask to suspend the rules so that we can vote on that. It's coming up before the next commission meeting. So that's what we're looking at, trying to make something that is, we won't have tent police, but it's easy to tell if there's a weight or a sandbag on them. And if it's a tournament, the person that's in charge of the tournament would be responsible to make sure that the folks are doing what they're supposed to be doing. If it's an event that we're putting on, we would be responsible. If it's an event like the Positively Midland, their coordinator would be responsible to make sure. And then we would reserve the right to ask them to leave if they don't have proper weights. So we wanted to just go into more detail into what was in there, which didn't really say a whole lot, other than you couldn't have any kind of structure erected, whether it was permanent or not.
So you're talking about specifically these 10 by 10
Pop-ups.
tents that, I first thought you were talking about tents people were gonna camp in.
Oh, no, sorry, no, pop-up tents, canopies.
Yeah, okay.
So, for Midland, for the 4th of July fireworks, since the tree has been talked about, they would be able to put tents up for shade, just like,
Personal pit,
just
yeah.
like anybody else going to the beach would be
Exactly.
able to put a tent up.
Exactly.
Okay, any other questions? Yeah, so do I hear a motion to suspend the rules to go ahead and vote on this evening?
So moved.
Okay, we have a motion and a second to suspend the rules. Any discussion? All in favor, please say aye. Aye. All opposed, no. That motion passes, and so I would entertain a motion to approve the updates to Chapter 50 of the county ordinance to allow and define the use of tents at active living and parks facilities.
So moved.
We have a motion and a second. Is there discussion? Hearing none, all in favor, please say aye.
Aye.
All opposed, no. That motion passes.
Thank you so much.
You're very welcome. Thank you. Okay, next up is item 4.2, and that is appointments to boards and committees. You all have a copy of that before you, and I think all three of the items on this are in regards to the child protection, child fatality prevention team that we just had extensive discussion about. And so this is correcting some of those things the statute said needs to be handled. Did you have anything you need to add, Elise?
Yep, I would just wanted to add that these are the names that Paula put forth on her presentation as well.
And so this gets the whole slate in compliance, taken care of.
Well, there are 5 other sort of at-large positions that we'll have to have some further dialogue about, but I am in conversation with Paula about how we want to move forward with those.
Okay, great.
But these are clearly defined in statute, and everyone's sort of in agreement in terms of who would fill those
Yeah,
slots.
okay. Anybody have any comments, questions, discussion on those? Okay, then we will move to item 4.3 from Cooperative Extension, budget amendment for plant sale and agribusiness days. We're happy to have Tracy LeCompte with us for that item.
Good evening. Thanks for having me and entertaining this budget amendment. As I've come to you before, we've had a really great year with a full staff, partially, and then we'll have our new livestock and field crops agent shortly. So we have had a great year with a lot of our traditional programs that have come back. We just finished up our spring plant sale, and it went above and beyond our expectations again. So I am here to ask for that budget amendment to be increased for both the revenue and the expenditures. So it's not asking for any more money from the county funds, but it is just raising our budget limit to be able to basically pay the people that we bought the plants from with the money that we made at the plant sale. And then the secondary one was with our recently completed agribusiness days that we had out at the Cabarrus Arena. We had that number in my head and now it's gone. Roughly 2,700 sixth grade students come out to the Cabarrus Arena where they rotated through 5 stations to learn more about agribusiness and environmental conservation that's happening here in the county. And we're really excited about that. We had all of Cabarrus County schools and multiple of our private and non-traditional schools come out for the day and for 3 days out at the arena. We want to thank all of our volunteers and everybody who was involved in that. It's a great opportunity to expose some of our young people to the world of agriculture. We had to increase that expense, and so in order to do such things that we actually charge the students to attend that field trip, so the schools cover that cost. And so that expense line went up as well as the revenue line that went up as well to offset the cost of that event that's held out at the arena. So you'll see an increase in that budget as well.
Tracy, could you expand a little bit on agribusiness days? If I remember correctly, that was a program that was previously held in conjunction with the county fair. You made a change because that was a lot going on at one time. I think there was some criticism of that at the time. So how'd that work?
Well, we're still, this is our second year of doing it in non-conjunction with the fair. There's still some kinks that we work out every year. I think it gets better and better. We do send out surveys to all of the students and the teachers that are involved in that, and we get great feedback every year. The overwhelming response from the schools and the school system and the teachers and everybody that was involved in that is that this was the best year yet. Being able to have the entire facility is key to having a safe event where everybody can rotate through. So essentially, each school gets to stay together in a pod, and then we break them into 15 smaller groups. They each have their own presenter. And so they're able to rotate from Gold Hall to the arena to Gold Hall Event Center arena and back. And so they go through all 5 separate stations, and everybody's able to kind of be in that area where we don't have to crisscross and all kinds of logistic nightmares of things. Since we've added another school, and since 2019, we've increased our student numbers tremendously. So being able to help that, anything we can do to help with logistics, bus drop-off, any of that kind of stuff, when you're talking 2,700 students trying to do logistics for 2,700 students it's a interesting affair. So anything we can do with that. There's still, our volunteers are grateful for having it at that point because then we're able to focus on the fair when it's fair time, and we're able to focus on agribusiness when it's agribusiness time. There's definitely some drawbacks to it. The fair has much more of a livestock component there, so there's animals in the room where the youth can see them and have more of an exposure to the different breeds and varieties and the diversity in the room at the fair. And so we're still trying to figure out how to best serve that aspect of it. We were able to add, since we have more space, we were able to add the fifth rotation is actually careers. So local Cabarrus County careers that are related to agriculture, and not just a guy on a tractor, but all the other things that are related to agribusiness in Cabarrus County, where you can go through that in partnership with the CTE teachers and the program with Cabarrus County Schools in Kannapolis. So we're really excited about adding that to it. And so we hopefully are able to broaden the scope of agribusiness and agritourism and all the agriculture world that is in Cabarrus County still, and really showcase and highlight that. So, we're still collecting feedback on it and how we can grow and move that forward. But it's definitely space-wise and logistics-wise much easier to not have to navigate and share the space. But of course, the fair brings its own form of fun to it, so we're still trying to navigate that.
Great, thank you. Any other questions for Tracy? All right, thank you. Okay, next up, forestry sale at Stonewall Jackson property, and Kelly Sifford has that item.
Thank you. To make this a little more efficient, I'm going to request that all three of my items, that we suspend the rules, and so maybe we can do the suspension all at one time. That way you don't
Okay.
have to keep voting on that. So would you like to do that first, or would you like me to discuss them and then do it?
Let's hear the discussion and then we can act.
Okay. So as we've talked about this forestry sale a couple of times now, and I have been waiting on the bids. We did get the bids back. We only had one offer. It was for $92,778, and it is Piedmont Hardware Lumber out of Mount Pleasant, so it is a local company, fortunately. We are working to negotiate and see if we can get that any higher, but the pulp business is not doing well, and that was mostly what we had in this case. So I'm looking for you to approve the $92,778 with the hopes that that will actually go higher. And so, are there any questions about that part?
Okay, did we get the easement access?
Well, that's where I'm going next.
Okay.
So I am requesting authorization for county manager to execute a temporary agreement for up to $2,500 for the temporary access for us. We have had some positive conversations. We haven't gotten to a complete agreement, but I think we'll probably be able to get there. If not, I may have to come back and ask for a different amount, but we think this is a reasonable offer.
Kelly, going back to the Piedmont hardwood for the harvesting of I'm assuming, is it pines or hardwood or everything?
Well, it's, unfortunately, the area that we have, I think, was mostly a pulpwood market, not so much hardwoods for where we were at and working in that area. So that market's just a little depressed right now. Several paper factories have closed in the past couple of years, and a lot of places, in fact, are just kind of chipping it and leaving it where it falls.
Well, we just glad we could get something out of it. We don't have anything in it, so
Right.
it's, going to help us with our plans
Yes.
to do what we need to do out there. So
Yes.
I'm surely okay with that.
Okay,
Okay.
you want to move to the next item?
So the final item is the final budget amendment that Suzanne kindly prepared for me for the purchase of the property at the Lomax Farm for $100,000 out of the deferred taxes into an expense line item where we can purchase that. They have signed their portion and sent it back and agreed to that amount, so we should be able to close fairly quickly if this is approved tonight.
Questions for Kelly? Okay, then we will move back to the first item, and I would entertain a motion to suspend the rules of procedure so that we can act on these three, 4.4, 4.5, and 4.6. We have a motion and a second. Any discussion? All in favor, please say aye. All opposed, no. That motion passes. So in regards to item 4.4, I would entertain a motion to approve the sale of timber and approve the necessary associated budget amendment. Okay, we have a motion and a second. Any discussion? All in favor, please say aye. All opposed, no. That motion passes. In regards to item 4.5, purchase of a temporary easement for foresting at Stonewall Jackson property, I would entertain a motion to approve the purchase of a temporary easement for forestry at Stonewall Jackson property and the necessary associated budget amendment. Have a motion and a second. Any discussion? All in favor, please say aye. All opposed, no. That motion passes. In regards to item 4.6, I would entertain a motion to authorize the county manager to sign purchasing agreement after review and revision by the county attorney and approve the necessary budget amendment and project ordinance for the purchase of property at Lomax Farm. We have a motion and a second. Any discussion? All in favor, please say aye. All opposed, no. That motion passes. Thank you
so
very much.
Appreciate it.
And we move to item 4.7, restructure Department of Social Services, Legal Services. We have Dr. Elise Pugh and Rodney Harris to talk about that item.
Thank you. I also invite Evan to join us, should he so desire. So obviously, this is an item that has been pending since our February meeting. I wanted to take this opportunity to provide some more information to you so that you can make an informed decision about whether we should move forward on this item. So, might have some technological kinds of issues here. But I can go ahead and get started while we're getting that pulled up. That's okay, while we're getting that pulled up. And so just wanted to remind everyone in terms of kind of our current state in terms of legal services to support our DSS operations. So previously, 10-plus years ago, we did have in-house legal support, as you all probably recall or probably had heard. We began contracting with our current legal provider approximately about 10 years ago. And so one of the things that I really wanted to emphasize to you is, A, in terms of all of the different programs that are being supported by our legal team, and then also kind of how the climate, how the landscape of DSS has changed. This was great to have this paired with the report that just happened about an hour or so ago in regard to child fatality, because one of the things that that team really emphasized is the increase in the number of children in custody over the course of the past 10 years or so, and that is, I have the numbers to reflect that as well. So in terms of which programs are being supported by our DSS legal team, you're talking about Child Protective Services, which includes anything related to abuse, neglect, and dependency. Permanency planning is part of child support. Permanency planning is when a child comes into custody, right? So there has been an allegation or substantiation of an allegation related to child maltreatment, and the court has decided that we needed to take custody of that child for that child protection. So that is the permanency planning side. Adoption services is, for whatever reason, there has been a determination that the parental rights of that child need to be terminated, and then that child is put up for adoption in our system. Adult Protective Services is on the adult side of the house, because we talk a lot about child welfare, but of course, we also have vulnerable adults that we serve as the guardian for them as well. And similar kinds of issues in terms of abuse and neglect on the adult side as well, and that relates to our adult guardianship services. And then, of course, the third there's three kind of big buckets that our legal team is providing support for. So just to kind of collapse that for you, the first big bucket is child welfare or child protective services. The second bucket is adult protective services, and that bucket is pretty small. The third kind of medium-sized bucket is child support enforcement. And so that's the third area. So again, in terms of the ever-changing landscape of Cabarrus County DSS, and again, the report this earlier today really kind of highlighted this as well, is that it has changed exponentially over the course of the past 10 years. 10 years ago, or 10-plus years ago, in 2012, we only had 71 children in custody in this county. As of December of 2023, we had 182 children in custody. That's an increase of 156%. Likewise, on the adult side, in 2012, we had 30 adults in guardianship. In 2023, we had 63 adults in guardianship. That equates to an increase of 110%. And because of the ever-growing nature of our county, we just anticipate that these numbers are going to continue to increase. Child support referrals have been relatively stable since about 2017, so those numbers haven't fluctuated that much. There have been some questions in terms of the billing for the services, and so I just wanted to provide you a breakdown of a full year of billing for the legal services for supporting our DSS operations. So these are the billing hours billed for fiscal year '23. So we're talking about July of 2022 all the way through the end of June of 2023. So again, I divided them out in those kind of bucket areas. Child support, that's child support enforcement. Child protective services, that's anything related to child welfare. And then adult protective services. And then we also have a training bucket as well, because our legal team provides some training to support our staff as well. So that first column is the number of hours billed during that entire fiscal year. This third column is the total billable amount based on the contracted rate. That fourth column, which we really haven't highlighted too much in all of these discussions, is the amount we get back from the federal government. So even though we paid, you'll see at the bottom of column 3, we paid $411,000+ to our legal support. We received $223 of that back from the federal government. So our out-of-pocket expenses in fiscal year '23 was, I have that number here, was $188,000, hold on a second. And $10.80. So if you, and then the last column, I just wanted to kind of break that down for you as well, because the rate of reimbursement we receive from the federal government depends on the DSS program. You'll see for that first bucket, child support enforcement, we get 66% of that back from the federal government. So our our portion, the county's portion, is only 34% for anything related to legal services supporting child support enforcement. For our other two buckets, child protective services and adult protective services, it's about roughly 50%. So when you collapse all of that together, the overarching rate of reimbursement is roughly about 54%. When you look at all three, when you collapse it across all of those different program areas, if that makes sense. Any questions about that? Okay. So the other thing I wanted to just really kind of highlight in terms of operational considerations related to this potential decision that you all are contemplating for us as not only our Board of Commissioners, but I know that you all are aware of this, you are also our Board for Social Services as well. So in terms of legal support, the current state is our legal team is located off-site because they are not county employees. Their offices are located elsewhere, right? We are contracted with them to provide part-time support, for them to provide us part-time support. I do understand that at times they go above and beyond, and I recognize that. But in terms of what we're contracted with them for, we are contracted for part-time support. I would argue that it's a somewhat less efficient model for our team in terms of being able to access the team simply because they're not on site, right? So there's a very big difference, with someone who is, across the street or down the street or a couple miles away versus someone you could literally get up out of your cubicle or leave your office and walk down the hall and have a real-time conversation with an attorney who is embedded within your team in your office. So just wanted to highlight that. And then, of course, it's more difficult for us, the leadership in human services and social services, to monitor accountability with it being an external vendor for our legal support. So in terms of a possible future state, like how it could potentially be different, we, again, as I just mentioned, we could have legal team embedded with our staff for convenience. We would have full-time support, an attorney or two attorneys, whichever you all decide, should you decide to move in this direction, of individuals who are 100% devoted to our operations and our needs for our DSS programs. That is their full-time job, and no conflicts in that regard. We also anticipate increased efficiencies in that regard and improved accountability because these would be county employees. So what's the norm in North Carolina? So just coincidentally, The North Carolina Association of the Department of Social Services in March, it was after our February meeting, they sent out a survey to all 100 counties in North Carolina, and they asked the question in terms of what is everyone doing regarding legal services? So 56 local governments responded. The questions were worded a little weird, so I'm not quite sure that everyone answered them consistently, but this is what I pulled away from that, from the results that were provided to all of us DSS directors. So the first column are counties that employ all legal support. So whether it's the county attorney or DSS attorneys, they employ all of them. So 15 counties out of the 56 that responded said that that's what they do. 7 employ legal support only. So they might contract out their county attorney, but they employ their DSS legal attorneys. Another 11 have a combination thereof of internal and contracted legal support. So if you look at it all together, there was 30 some odd counties that in some form or fashion employed DSS legal attorneys. And the reason why I thought that that might be important to highlight is over the course of the past couple months of we've been having these conversations, I think there have been some comments about, well, you know, these attorneys don't exist. I would argue they do exist. They exist here in North Carolina. They've been providing this service, not only in surrounding counties, but throughout the state. And so there is a pool of attorneys who are dedicated and devoted to DSS operations that we could potentially recruit for this effort, should that be your desire. So in February, we presented to you pretty much a singular option. Today, I would like to revise that and present 2 different options to you for your consideration. The first option would be very similar to what we proposed in February, which is to hire 2 attorneys, a lead attorney and a staff attorney. The goal would be to try to onboard these individuals by the first part of July and to gradually phase out our contracted legal services for the department here in Cabarrus County. A second option would be a more graduated plan where we do it in more of a phased approach, where we hire 1 staff attorney to begin. And I would recommend that that 1 attorney starts with child support enforcement and adult and aging services. So 2 of our 3 program areas. As I mentioned, and you could see in the other graph, child welfare is the biggest book of business for our DSS operations. But again, we could try this in more of a graduated approach if we started with 1 attorney, had that attorney focus on 2 of those areas, and thereafter kind of assess the model on an ongoing basis. If we chose option 2, we would continue with contracted legal services on a more limited scale for solely for child protective services or child welfare. So I know this is a little hard to read, but you have it in front of you on your computer screens. But we also wanted to show, and I thank Evan for putting these together for me, wanted to show you what a potential reporting structure would look like for both options. So if you went with option 1, which again is to hire 2 attorneys, and we'd phase out the use of contracted legal support, most of the information from the School of Government with UNC suggests that those attorneys would sit under the umbrella of Health and Human Services. So the lead attorney would report directly to me as the Director of Human Services, and then the staff attorney would report to that individual. However, if you chose the second option, what we would do instead is, since by nature it would be a staff attorney, seemingly someone who's a little bit less seasoned, we would certainly want that person to have the support of a more seasoned attorney. So we would have that individual reporting to Evan. And then should we change and decide to hire a lead attorney at some point in the future, then we can change the reporting structure. But we would obviously want that person to have the support of someone within his or her discipline that they could report to. So this is what it would look like in terms of a potential reporting structure for option 2. And with that, I conclude my presentation, and I would like to open it up for questions.
Questions, commissioners, for Dr. Pugh?
I have a question.
Yes, sir.
You know, looking back a month or two ago when this was first presented to us in the
Yes.
recommendation,
Mhm.
you know, you guys were so convinced then that option one, where did option two, why did it come into play?
For a variety of different reasons. What I can say definitively is, in my professional opinion, it is in our best interest to move forward with bringing legal in-house. Having served in the role as the interim DSS director, I think from a business standpoint, it is in our best interest. I also understand that Cabarrus has been doing things very differently over the course of the past 10 years. And for a variety of different reasons, it might be easier and more easier for people to adjust to the change if we do it in a more graduated fashion.
Yeah, because, you know, from what we heard earlier today, we know how critical this is, and whatever we choose to do, this is going to have a big effect on a lot of people. So, you know, with the option two, I would guess that would give most people a better feeling that things will be transitioned better or more normally.
I do, well, let me go back for just a second. Regardless of whether we select option one or option two, my recommendation is that we continue to contract with our current legal provider for at least another year. Because even if we go with option two in terms of hiring two attorneys, it is going to take time to transition all of the services. There are outstanding cases, some of which that are scheduled months out. So it is going to take time, and I do recognize that. And I do think that part of concerns that had been raised by staff were related to that, just making sure that our children and families have the appropriate legal services and care that they need if we decide to move in this direction.
And just really quickly, I'll say, I don't want to speak for Mike, but part of option two also came from conversations Mr. White and Mr. Downs had about kind of how we could transition. And then one point really quickly about child support is those, as Dr. Pugh said, those numbers are more steady. Also, child support is, if you look at the billable hours from the Hartsell and Williams firm, it is a lower amount because child support doesn't have the investigatory piece. It doesn't have all the number of permanency planning hearings and things like that child welfare has. So with child support, really, you're looking at, based on Mr. White's billable hours, 50, 60 hours a month, which is really kind of a half an attorney. So that's an attorney that could be doing child support and adult aging, but then also helping me with things that fall under the other general county umbrella. You know, option one is more what the department is looking at.
I don't want to speak for anybody else, especially because he's not here, but Commissioner Meesmer sent an email asking about a advisory committee to be put together of certain key players that deal with this for a living. Where do we stand on that committee and those people being contacted? Because this is obviously a very important decision that we want to get right. So where do we stand with that committee being formed?
I'm trying to turn this on.
I know, that's very, it's very sensitive. There we go.
Yeah, so we would, in the note that I'd sent out to the board as well as Commissioner Meesmer, is that if you so choose to move in this direction, we can have those conversations and pull those individuals together over the next 2 weeks, so that prior to your decision in 2 weeks, or when you decide to make that, then we'll be able to give you that feedback from that group.
I don't know if now's the proper time or not. We might want to make this change at the end when we adopt the general meeting agenda. But I would like to see this item here, number 7, taken off of the consent agenda, which is what it's on, and move it to the new business so that everyone will have a chance to vote on it. I know Commissioner Meismer would surely want to vote on this, and so rather than being on the consent agenda. So I don't know if now's the proper time, and if you need a motion, I'll make the motion that we take this off the consent agenda and move it to new business if you need it. And if you just need consent, that would be up to the board.
Let's see, that would be F5. So we would move F5 to C, which would be new business. Yeah, we can handle that when we approve the agenda. If you would like, I've made note of a couple other changes as well. So if I'm hearing the county manager correctly, we could potentially meet Commissioner Meismer's request and convene this committee between now and our regular meeting for them to bring back their comments and recommendations during our discussion during new business. Am I interpreting that correctly?
Yes, sir, that's correct.
Does that work for you guys? And I think he had spelled out who he wanted to be on that committee as well. And so, that good with everybody? Okay, well then we shall proceed in that fashion. Any other comments, questions on that item? Okay.
Thank you.
Yes, ma'am. Thank you. Thank you all. And we will move now to item 4.8 from Emergency Management. Happy to have Jason Burnett with us to talk about that item.
Good evening, Commissioners. Emergency Management has been awarded a North Carolina Tier 2 competitive grant requiring a budget amendment. North Carolina Tier 2 grants provide local emergency planning committees, better known as LEPCs, with funding to expand the scope of their hazardous materials emergency preparedness programs through response planning, training, and exercise development. Tier 2 is defined as an annual federal report that is mandatory for facilities to file that store hazardous materials or hazardous chemicals. The grant award is in the amount of $2,000 and does not require a match. Funding will provide lunch and learn training opportunities for our LEPC, which currently meets on a quarterly basis. We continue to see steady increases in participation within our LEPC through these efforts and increasing their overall added value to this committee. This item does require a motion to accept the grant award and adopt the associated budget amendment. And at this time, I'll be happy to answer any questions that you may have.
Questions for Mr. Burnett? Very good. Thank you, sir.
Thank you.
All right, next up, item 4.9. Jimmy Lentz is with us to talk about medical supply budget amendment.
Good
Welcome,
evening.
sir.
Thank you, and good evening. We have found ourselves, because of several reasons, the annual call increase, the inflation and price increase in medical supplies, and the fact that during this current fiscal year, we've been put in a position to not being able to acquire our controlled medications from Atrium Cabarrus anymore. So we're purchasing them on our own, and we obviously have the facilities and all to accommodate that. Going a little bit further, we will be, as of July 1st, we'll be getting all of our medications on our own. The cardiac meds, everything not controlled or that doesn't fall in a controlled fashion, and we have made budget preparations in the planning for FY 25 for that. But what we come to you tonight is for a budget amendment. We're gonna, the estimated figure to get us through the current fiscal year in need is $168,000. And we come for a budget amendment. We are fortunate to be in a position that our estimated collections are enough to cover this. So we're asking for a budget amendment to accommodate the move from collections to, and if we need to elaborate more on the financial side of that, Jim or Suzanne can elaborate, but that's what we're asking for.
And so what caused the change with Atrium?
It was nothing at fault or wrong. They had some procedural policy changes, and we knew it was coming one day. We didn't expect it, and I'm speaking more now for what we're going to income or what we're going to take our have with the new budget year come July 1st, to where we have to do all our medications in-house. We knew it was coming at some point. We did not expect it this soon. It was of no wrongdoing of anybody. It's some procedural changes with pharmaceutical rulings and Atrium internal policy.
So, as is stated on here, we will no longer benefit from their bulk purchasing ability, so those medications are going to be more expensive.
There is a slight increase anticipated, but we have found several coalitions, just like other purchasing coalitions in which the county and EMS in general participate in. I know SAVIC is a common one that we use to acquire our vehicles. But we have, Chief Malden actually met with a coalition yesterday that is not going to be nearly what we anticipated, and it appears it's going to be basically, there is going to be an increase, yes. It's not going to be nearly to the degree that we were afraid it was going to be because of these other avenues we found.
Questions for Jimmy? All right. I think you have the
I have the next one
item
too,
as
and
well.
it hopefully will be relatively quick too. It is coming up, the end of this current fiscal year will be the final date for the current contract with our non-emergent provider that handles all of the scheduled discharges from the hospital, doctor's visits and stuff of the non-emergent, non-911, non-emergent transport needs of the county. It has been contracted for the last 6 years with American Transmed. That current contract will be coming to the end of the current fiscal year, and we are recommending to renew a new contract with American Transmed for the next 3 years. And I would ask Mr. Cook to correct me if I misspeak any of this, but that franchise agreement needs to be heard in 2 consecutive monthly public meetings. So I will be reading that at the regular meeting in 2 weeks, and then we will repeat that again, and I will read it again in May. And after the May public hearing, there will be action taken on it, if that's the way I interpret this correctly. So,
Franchise it, you have to do that.
And so the terms are not changing?
correct. It's the same company. It'll be another 3-year contract. We've had very good luck with those, or with American Transmed. They obviously helped us and mitigated and navigated through the pandemic and everything over the last 3-year contract, so we are recommending to stick with that company and renew again.
And most of the charges incurred there are billed to the
Correct. There is no
service
cost,
recipient.
right, there is
Yeah.
no cost to the county. It is, they come in and provide a service and are reimbursed from the individuals they provide service to. But ultimately, all county EMS falls under our system plan, so that's why this has got to be handled in a franchise agreement.
Questions for Mr. Lentz? All right,
Thank
thank
you.
you, sir. Okay, we move to item 4.11 from Human Resources, Health Insurance Plan Renewal, Lundy Covington and Joanna Ray. It looks like Lundy came without Joanna. No, there's Joanna.
Good evening, Commissioners. Joanna is actually on vacation, spring break with her family, so she is joining us online. So she'll be a part of this. And of course, you probably recognize Linda Klein, who was with us at our retreat. And this topic is basically going to be a bit of a review of that, and we have a need for direction on and dental plans this evening. So it is another item we'd like to ask you to pull off and give us some guidance this evening. So Joanna, are you on and able to commence the presentation?
Yes, can you hear me and can you see the presentation?
We see it and we can hear you.
Perfect. Okay, so we'll review the FY25 benefit renewal for medical and the dental plans and cost, and this will help us prepare for open enrollment, which will begin on May 6th. For the FY25 plan designs, the county asked USI to compare the current plans to the benchmark groups. And in the recent comparison to the benchmark, we found that the high deductible health plan has an actuarial value of 86% with a health savings account. And then the current open access plan and design has an actuarial value of 71. And this is compared to benchmark groups between 77 and 85% for traditional OAP PPO plan type. And at the retreat, we proposed to improve the plan to bring up the value to 83%. And this is closer to the higher deductible health plan and also the open access plan benchmark groups. This next slide will show the proposed plan design changes. So in gray, you can see the current
Joanna, we
plan
don't-
designs that we're offering today. In the last two columns are the proposed changes that we have
Joanna, you're cutting in and out on us.
for FY20.
Joanna, you need to repeat that. You're breaking up.
Can you hear me now?
Yes.
Momentarily, we heard you.
Can you hear me?
You're
No,
breaking
you're
up
still breaking
badly.
up.
You want me to pick it up, Joanna?
Yes.
Okay.
Or I can.
One of us will help fill in. We were worried that might be an issue. So you'll,
Let's see.
Share the presentation, it'll cause her to use less bandwidth and we can hear.
Okay, is that better?
Joanna, they're going to take over sharing the presentation, so you'll come through a little more clearly with us. So just give Lauren a second to pull up the presentation. And per Todd, that should give you more firepower to speak with us. Okay, she's got it up, so if you can repeat that last section. The plan modeling slide is up, so just explaining the differences that they'll see.
Oh, can you hear me better now?
We can, I think.
Who wants to take it over?
Linda,
You want me
take
to?
this one. You
So,
take this one. I'll pick up
okay,
that.
what,
IRS minimum deductible will change.
Hold on, Joanna, we're gonna let them take it over here because you keep going in and out.
sorry, Joanna, I know you'll do a better
Okay.
job than me, but I'll try and help out here. So, what you're seeing on the screen or in front of you on your computer is the current plan designs as they are today. You have the high deductible health plan and the OAP, which is just another fancy way of saying a traditional PPO plan, right? Co-pays, deductibles, that type of thing. So, on the right, the last two columns, you're seeing the options here. The only proposed change to the high deductible health plan, where 78% of your employees are enrolled in that plan, is we have to increase the deductible for single and family because of federal guidelines. They index those from time to time. So you have to have a minimum deductible in order for it to qualify so that you can make HSA contributions and employees can make HSA contributions to that account. So that is a change that has to take place. And what we were talking about is some proposed changes to the OAP or the PPO plan to get it closer to benchmark data. And when we looked at benchmark data, the USI benchmark survey has respondents from 10,000 employers across the country. So we are benchmarking your plans against other county governments, other employers in this region, and other employers of your size. And so what it was showing is that plan, the plan design richness of the plan is not comparable to what the benchmark survey says. So we are looking to make improvements to that plan to get closer to the benchmark plan design. So you can see that here. We're looking to reduce the deductibles, reduce out-of-pocket slightly, and then reduce the primary care physician copay a little bit from $30 to $25, gets it closer to benchmark. Currently, you don't have a copay for specialist. If you need to see a specialist, it goes towards your deductible. So we're proposing adding a copay there to make that more accessible for employees. Emergency room copay, and then some slight improvements to the pharmacy copays. And that gets that plan closer to benchmark norm.
Okay, Lauren, if you could move to that next slide. So this is just kind of to recap what we're basically having a choice of. There's two options that we presented at the retreat, and one is just to maintain the plans as they currently exist. There is an additional cost just because of inflation with the health insurance as it's increasing. So you'll see the additional cost to the county for that option. If, however, you're agreeable to us making the enhancements to the OAP plan, that would be an additional $347,000. So not a huge incrementally, but it would definitely provide a better benefit and would probably give some of our employees a different choice or option. I think we would see some steerage out of the number in the current plan into that OAP. So any questions on that? I don't want to go through it deeply since we talked about it already, but if there are questions, that's why we have Linda here, and I also have Suzanne out there in the audience if you have questions on the cost aspect. Okay, so that's one item we're needing to discuss tonight. The other item is regarding our dental plan. And our dental plan, if you'll do one more slide for me, Lauren, is 100% employee funded. We would just like to basically continue that on as a one plan option. There will be an increase to the employee premium. So this one is just more or less to make you aware of what we need to do based on the renewal that's coming back for the dental plan. So the final slide is just kind of summarizing this as far as the requested action. And what we really need this evening, if possible, is to move this forward into a decision framework so we can prepare for open enrollment for our employees. So staying with the current plan as they exist or moving to the OAP enhancement. So if there's questions that we could address or answer, happy to do that. And again, Joanna's on the line if we need her as well.
I'm in favor of option 2.
Any other questions, comments? I would echo that. I think option 2, and I think kind of our discussion at our retreat sort of indicated the same. I see head nods across the room. So I would entertain a motion to suspend the rules.
So moved.
Second. Have a motion and a second to suspend the rules. Any discussion? All in favor, please say aye.
Aye.
All opposed, no. That motion passes, and I would entertain a motion to approve option 2, which improve the alternative OAP plan as presented with an estimated additional cost of $347,000.
So moved.
Second.
We have a motion and a second. Any discussion? All in favor, please say aye. All opposed, no. That motion passes.
Thank you, Commissioners.
Thank
That-
you.
Thank you. Do you need the dental rate premium? Do we need to act on that?
I don't know that requires votes. It's a self-funded.
It's a voluntary plan for the
Yeah.
employees, so it's an increase.
If you find out it is, we can keep that on
Still a
consent.
benefit we're offering, right? Still a benefit that we're offering,
It is.
yeah.
But you
We'll check it.
It's 100% voluntary.
Yeah, it's 100% funded by the employees. It's just you are offering the plan, so I think if you guys are comfortable with it, I think we're okay.
All righty, thank you. Okay, we move now to item 4.12. Chief Tessa Burchett has very patiently waited to the very last item on the agenda. Welcome.
Thank you. Good evening. Hope you all are well. I have a quick item. It's a budget amendment, and as you may recall from last year, since the state enacted the Raise the Age legislation, which essentially said that all juveniles are anyone under 18. Of course, that means that the state has to house all of those inmates that are under 18, which means the county is responsible for paying the state for that. That continues to increase, just the numbers of juveniles and the cost of it. And so we are quite a bit over budget. Fortunately, we do have revenues from housing inmates from other jails in the area, as I've spoken to you about, Stanley County, Union County, Anson County. So what I am asking is for you to approve the budget amendment to budget those revenues. Currently, we have $177,000 in those revenues, and we will continue to generate those revenues through the end of this fiscal year to the total of $234,360. I'd like to budget those revenues and the expenditures to pay for the juvenile detention detainees to the state.
Questions for Deputy Burchett? All
Thank you
right.
so much.
Thank you very much. Okay, we move now to approval of the regular meeting agenda, which we have juggled around quite a bit throughout. And so if you'll look at your copies, I'll tell you what I have. First of all, I propose that we add an item C7, which is the Child Protection Team Report, which we talked about earlier, having that at our regular meeting. I think Ms. Yost said she was available, but we'll double check that. So that would be C7. And then also to add, to move item F5 to be item C8. And I think that was the legal services. And then to remove item.
It should move to G2.
G2, a new business, okay. G2, so that, the legal services one, okay, would be G2. I can't do this when you print on both sides of the paper.
Save the tree.
And then to remove items F4 and F8. F4 was the forestry sale, which we went ahead and voted on that. F8 was the health insurance plan, which we already voted on that. Does anybody have any additional changes to the regular meeting agenda? Okay, in that event, I would entertain a motion, or I would make a motion to approve the regular meeting agenda as I just described. Okay, we have a motion and a second. Any discussion? All in favor, please say aye. All opposed, no. That motion passes. We do have need of a closed session tonight, so at this time, I would entertain a motion to go into closed session as authorized by North Carolina General Statute 143-318.11, A, 3, and 5, for the discussion of acquisition of real property. Okay, we have a motion and a second. All in favor, please say aye. All opposed, no. We are now in closed session. Thank you all for joining us.